Hello, and my name is Nancy.
Hello, my name is Rowan.
And welcome to Hands on Health. This is a program established by the Deaf and Hard of Hearing Services, DHHS. Our intent is to discuss important health issues and educate and empower all of you to help each one make good determinations regarding your health.
And our topic for today's show is COVID vaccinations. We have a special guest with us, Karla Black, who's from the Kent County Health Department, KCHD. So welcome, Karla.
Welcome.
Can you let us know what your role is at KCHD and what it is that you do there?
So at the Kent County Health Department, I'm the Emergency Preparedness Coordinator. So basically I deal with all the bad things that could happen in public health. So pandemics such as COVID-19, but also I deal with floods, fires, tornadoes, anything bad that can happen. So our job is to plan for, respond to, and recover from disasters. But in a previous life, I was a scientist, and so I used to work on viruses, and so I'm pretty used to talking about viruses at this point, especially about COVID-19.
That's really good. So in general, when we're looking at vaccinations or vaccines for COVID, can you give us some information, just general information?
So generally, I brought back my little COVID-19 plush. So a lot of times when we have vaccines, so not talking specifically about the COVID vaccines, but talking about vaccines prior to the COVID vaccines, normally what we would do with a virus is either one, we would use chemicals and treat the virus so that it would break apart or it would just be inactive, and you would inject that into the body for your body to say, hey, that's something I don't recognize. And so it would make antibodies so that the next time you were exposed to that disease, you wouldn't get sick. But other ways that we've had vaccines in the past too is that we would keep passaging a virus along so that it would have new mutations so that it wouldn't make you sick. So it's still the virus, but it's not going to make you sick. And so then we would inject that into you as a vaccine. So yellow fever is a vaccine like this, and it doesn't make you sick. And so when you do get exposed to yellow fever or the flu or whatever, which one it is, you're not going to get sick. So that's how vaccines normally work, but I know we have a couple questions coming up that we're going to talk about the new types of vaccines that we've had with COVID-19.
Great. So could you expand then on the COVID vaccination?
So as everyone's heard, we have a new COVID-19 vaccine. And so these do work a little bit differently than how all the vaccines that you're used to, like measles, mumps, yellow fever, influenza, have worked in the past. So a lot of people have heard about the mRNA vaccines. So you might have heard Pfizer or Moderna. Those are the types of vaccines that use this new mRNA technology. And so what's different about these is that we don't actually use a full virus at all. There's no virus in the vaccine whatsoever. There's a piece of mRNA. And what mRNA is it's kind of like instructions for your cells to make proteins. And so this little piece of RNA, along with some fats and some salts that kind of keep that mRNA stable, basically we inject that into your body, it gets into your cell, and so that mRNA has instructions on how to just make this little tiny piece, the spike protein. That's all it makes. It doesn't make a full virus, it just makes this one little tiny protein. And so then your cells recognize, hey, that's not mine. And so it starts making antibodies against that one little tiny protein. And so then when you're exposed to COVID, because it has spike proteins all over it, your body recognizes this isn't mine, and so all the antibodies it's made against these spike proteins are going to then kick in, and hopefully then you won't get sick. So that's how the new mRNA vaccines work. So there aren't any full viruses or anything like that in there. In fact, in old vaccines that we've had prior, we've had full viruses in them, but this one doesn't. Johnson & Johnson's a little different, so it's not an mRNA vaccine. It does use a virus, which we call an adenovirus. So it's a different type of virus that kind of causes colds and things like that. But it's been engineered basically so that it carries, again, just the spike protein instructions to your cells. So it just makes spike protein again. So it's just that other type of virus is just a carrier, so it gets to your cells. But again, for the coronavirus itself, so for COVID-19, it just makes that one little tiny spike protein. It doesn't actually bring the whole coronavirus into your system or anything like that. So that's how the new vaccines work. So you've heard a lot about how they're different. So mRNA versus Johnson & Johnson. With the mRNA vaccines, those are two shots. So you need to have 2 doses of it for it to be fully vaccinated. So for Pfizer, it's usually around 3 weeks. It can be extended out longer, but then also Moderna, that's actually 4 weeks between your shots. But you can extend that out too. So if you're not scheduled for your shot exactly on day 21 or day 28, it's okay. People don't need to worry if it's on day 25 or day 30 instead. With Johnson & Johnson though, it's 1 shot and you're done. So you don't have to worry about scheduling a second appointment. But they're all great vaccines.
Thank you. Boy, this is good information. How can we get those vaccinations quickly? Where do we start?
So I think you're asking about how we were able to make new vaccines so quickly, because I've heard a lot of people say that came really fast.
So how was it developed so quickly?
So scientists have been actually working on these for a very long time. So back when SARS, the original SARS, before this one came around back in 2003, they were starting to work on an mRNA vaccine even back then. And so scientists have been working on this type of vaccine already for a very long time. And because of the pandemic, you know, money makes the world go round. Money is important. And so when lots of money got shoved into the scientific community so that there was lots of money and all the scientists started working on the same project, it's amazing what you can get done really quickly. So the platform, the mRNA, has been in development for a very long time, but also we've had a lot of money and a lot of scientists working on the same thing together, which is really great. So that's why we were able to get this put together really quickly. And also mRNA is actually really easy to make in a lab. I've actually made RNA in a lab before, so people like me can do it. So mRNA is a lot easier to make in a lab than growing up virus in chicken cells, chicken eggs for like flu vaccines. So that also speeds things up too. So there's lots of different reasons why it came so quickly, but to me, it's been years and years in the making, honestly.
Interesting. So the vaccination was developed quickly. It seems like it was, but it's been around, been developed for a while now. So, but it's not yet FDA approved. Why is that? Is it still safe?
So the FDA approval, it takes a while to get through that process. And they have a number of different phases that they go through to become FDA approved. And so normally they start looking at how it works in the lab first. And once they've done that, then they start to go into the human trials. So they try to see how, first, of course, safety is always the first priority no matter what. They're always looking at whether or not that people have side effects, what levels are safe, and then what are the longer term effects. And so they're always looking at that safety piece. And so they've actually gone through all the steps of the trials, but because at this point they know that the vaccine is safe, but they know that COVID is very bad, and so the risks of using the vaccine outweigh the bad things that can happen with COVID. What the FDA and the CDC did is that they gave it an emergency use authorization. So currently it's authorized to be used because we're in an emergency, because the benefits outweigh the risks. But, so Pfizer has already submitted for full FDA approval. And what they really needed to do was to show, I think it was about 6 months more data, which they have been collecting over the time that it's been in use under the emergency use authorization. So hopefully in the next month, maybe 2 months, we will probably be seeing a full FDA approval for that. But they're absolutely safe because what they've been doing is always looking at that safety. And people can report that they've had adverse side effects overall. There's a system called the VAERS system where people can go online and report that they've had an issue. But also when you do get your vaccine, there's a program called Be Safe. And so they ask you, have you had any new medical conditions? How have you been feeling? And it's a really short survey that people can participate in. And I can tell you personally, I've been followed up with that because one time I said I had a migraine, and I have migraines all the time. They actually called me to check on me. And so they are really looking at the safety of these vaccines.
When we look at the vaccines, are they available to everyone? Are there some that can and others that can't, depending upon the side effects of the vaccines? Say, for example, you have allergies, or it's just not effective?
So the first thing I would say, absolutely talk to your doctor if you're worried about some sort of medical history that you've had that might indicate that maybe you shouldn't. For the most part, in general, most people are able to get the vaccine. The ones that we're looking at that probably should not would be people that have had anaphylactic reactions before, that with polyethylene glycol, which is one of those components of the fats and salts and all that, because some other injectable medicines have polyethylene glycol in them. So if you've had any sort of anaphylactic reaction before to injectable medication, that is something you should talk about with your doctor. If you've had any sort of anaphylactic reaction before and you carry an EpiPen, talk with your doctor first. Usually that's okay, but we want you to bring your EpiPen with you if you've had something like that before. But if you have any other conditions such as immunocompromised situations or anything like that, definitely talk to your doctor and they can talk with you on, is this something that will work for you? Because I know that there are other people out there that don't react well to vaccines, but have that conversation with your doctor and they'll be able to help.
So suppose I have already gotten the vaccination and I have some side effects or I have a reaction. Should I be concerned or should I wait and see if they resolve on their own? What should I do?
So usually the bad reactions are going to happen pretty quickly. So in any location that you get a vaccine for the COVID-19 vaccine, they're going to have epinephrine there. So they'll have EpiPens or other ways to administer that. So if you have an anaphylactic reaction, that they can help you. So that usually happens pretty quickly. However, there are other side effects that people can have with these vaccines, and for the most part, they're pretty mild and they'll resolve within about 2 to 3 days. And usually it's just having either a red site at where you got your shot, or your arm might be a little sore. Some people have headaches. You might not feel so great. You might have some body aches. Some people get a little nauseous, but they're pretty mild usually. Some people have worse headaches. When I got my second shot, I was pretty sleepy for a day. And so I really just wanted to take a nap. That's all I wanted that day. But for the most part, those side effects are going to be gone within about 2 days or so. If they tend to last longer, then you should see your doctor and ask about that. Or if you start having difficulty breathing, or if you have a rash, definitely call your doctor. Or especially if you're having hard times breathing, then definitely seek medical attention at that point. But usually any of those breathing problems happen pretty quickly right after.
In talking about the vaccinations, what ages would you recommend as far as age group, going from young people to older adults? What's your recommendation?
So at this point, the Pfizer vaccine is actually available for those that are 12 and older. And anyone who's able to get that should get it, because again, we don't really know what COVID can do to even younger people, because we hear a lot of young people say, oh, I'm young, I'm healthy, I'll be fine. But the problem is with COVID, we just don't know those long-term effects yet, because we've certainly seen a lot of people already have memory issues or heart conditions, still trouble breathing. We want people to still get that vaccine. So Pfizer is available for those that are 12 and up. Moderna is still 18 and above at this point, and so they are able, anyone can get that 18 above, and then also Johnson & Johnson is still 18 and above. So, but that Pfizer one does go younger.
So far, when the vaccinations have been distributed, we've been hearing some strange rumors or silly stories. I'm sure you've heard quite a few of those yourself. But can you maybe share some of the things that you have heard or myths that have been associated with the vaccination?
How long do you want me to talk? So I would say,
just give us the top ones you remember the best.
the first one that I've heard probably the longest and the most is that there's a chip in the vaccine. First of all, each of the vials that have the vaccine in it are multi-dose vials. So each one of them, you would have to be able to ensure that you pulled up the microchip. There is no microchip in there. And also I've heard that that microchip is the size of a grain of rice. If you've ever had a shot in your life, if you tried to inject a piece of rice into you, it would hurt, and hurt very badly, and it would be a very, very big needle. So there isn't a microchip in there, not at all. Another one I've heard that I've seen on the internet lately is that it will magnetize you, or that you can stick magnets to yourself. No. It will not, there's no magnets in it. It's not going to cause you to be able to stick a spoon to you. Usually that's just sweat if you stick a spoon to yourself. But there's no metals or anything like that in the vaccine. I mean, like I said, it's for the mRNA, it's just a piece of mRNA, salts, sugars, fats, no heavy metals. What other ones have I heard? I've heard that, I would say that those are my two main ones that I've heard the most by far. Are there any other ones that you've heard that you'd like to ask me about?
When we look at the vaccines, are we guaranteed 100% protection, or can we still contract some of the virus? How does the progression of the disease go?
And how effective is it?
Okay, so that's a fantastic question. So the vaccines are not 100%. Actually, none of the vaccines prior to the COVID vaccine were 100%. Usually for a flu season, we would say a 50% coverage on the flu vaccine is fantastic. With these mRNA vaccines, we're seeing coverage around 90 to 95%, which is amazing. So in Kent County, for example, where we currently are, and I know that your viewership is much larger than just Kent, we have over 300,000 people fully vaccinated in Kent County. We've had about 600 cases of people that have been vaccinated to get COVID, which, doing the math, that's less than 0.5% of people who've gotten vaccinated and that have then gone on to have COVID. So it's absolutely tiny, the number of people that have had breakthrough cases. Even if you do get COVID though, more than likely you're not going to end up in the hospital and you're not going to die, more than likely. Can't say that 100% on anything, but usually symptoms are a lot more mild, they resolve quicker, and so even though a lot of people are like, well, it doesn't protect 100%, it protects incredibly well. And so even if somebody's worried, well, it's not 100%, it's really, really a fantastic vaccine, and it can shorten your symptoms and have a much better outcome.
Thank you, Karla, for all that helpful information. Thank you for joining us today.
And thank you for watching our show, and we can't wait for you to join us again next time when we will be discussing new health issues. We would love for you to follow us at Deaf and Hard of Hearing Services on their Facebook page. Also, you can connect with us on YouTube, subscribe to us on YouTube so that you don't miss any of our future shows.
In order to support the show, should you like to make donations, you can go online at www.deafhhs.org/donate. If you should have any suggestions for future topics, any questions, please don't hesitate to contact us. Email, you may reach us for any further questions, and that is handsonhealth@deafhhs.org. Thank you.
Thank you. And thank you, Karla. Thank you so much for joining us again.
Thank you so much.
Thank you.